Good morning, it's October 30th, and this is To My Liberal Friends. We're now going into the fifth week of the government shutdown, and we're told this is all about the Democrats trying to protect people from losing their health care. That's kind of a false premise from the outset, because Chuck Schumer and his colleagues know that there are sufficient Republican votes to extend these subsidies. But this is about Chuck Schumer voting for the continuing resolution in March, and the left threatening his position as both the Senate Democratic leader and ultimately his remaining as a senator from New York. What nobody seems to want to talk about is why the Affordable Care Act, known as ObamCare, has been such an abject failure and led to rising premiums in the healthcare industry. Democrats don't want to mention that they increased those subsidies during the pandemic, wrote legislation to have them expire at the end of 2025 because they believe the pandemic would be gone by then, and now they demand that these government largesse be made permanent. The root problem that everyone ignores is the rising cost of healthcare, and the insurance industry that underwrites Obamacare keeps raising the rates. They do this because they know they can. Allow me to use an example. When my wife and I lived in Washington, D.C., my wife would commute using the Virginia Railway Express. The government gave commuters who used public transportation a subsidy to encourage that behavior if they were government employees. Every time the commuting subsidy was increased, you could immediately count on the Virginia Railway Express raising the cost of their fares. It was a symbiotic relationship. This is part of the healthcare premium problem. If the government increased the subsidy, insurers know they can increase the premiums. The one Senate Democrat sort of let the cat out of the bag about how the subsidy is allowing people to make decisions based on a government handout. In a recent social media post, Senator Amy Klobuchar from Minnesota said that if Republicans don't extend their increased subsidies, then early retirees like Bill and Shelley will see their health insurance premiums skyrocket. Color me stunned, but these two are retiring early and expect the government to pick up their health care costs. They're leaving the employer-provided health care plan to jump on one paid for the government. That led to some media people to take a look at this couple. They're 60 and 61 years old and have a retirement income north of $130,000. That's well over the 40% of the federal poverty level, but since Biden lifted the income limits, these two decided they had enough to retire and allow the government to pick up their expenses. I'm sorry, I worked until age 68 and I never got a subsidy. The facts are that Obamacare has caused insurance premiums to rise. There's no check on them as long as the government's willing to foot the bill. Even that ardent liberal, Elizabeth Warren, finally figured it out. Last year, she and Senator Mike Braun from Indiana wrote a letter to the Health and Human Services Department Inspector General complaining that the nation's largest healthcare insurers are dodging Obamacare's medical loss ratio. The result, they say, is higher costs for patients. Well, the medical loss ratio is a de facto cap on profits. It requires that insurers spend at least 80 to 85% of premium dollars on medical claims. Now, Democrats claim the rule would make health spending more transparent and reduce insurers' spending on overhead. Consumers will receive more value for their premium dollar, Obama said. Instead, as we've been pointing out for years, the rule has spurred insurers to merge with acquired pharmacy benefit managers, retail and specialty pharmacies, and healthcare providers. That's made healthcare spending less transparent since insurers can shift profits to their affiliates by increasing reimbursements. Hospitals have acquired independent physician practices to gain more leverage with vertically integrated insurers, allowing them to bill more for services. Independent pharmacies have closed or been sold to the giants. It's no surprise then that healthcare premiums have risen on average about 20% faster since 2011 when the MLR took effect than in the 5 preceding years. More fundamentally, Democrats howling about premiums is an indictment of the system their party built. The Paragon Institute, which covers healthcare, offered a helpful chart showing that expiring pandemic subsidies are responsible for about 3% of total 2026 premiums. Quote, the real drivers are the same structural flaws that have plagued Obamacare since 2014 and rising healthcare costs, end quote. The debate isn't whether premiums are going up, only how much the taxpayer should pay. Table stakes for any Obamacare negotiation should include codifying association health plans that let small businesses join up to form a larger risk pool to improve the economies of offered insurance. Ditto for continuing to expand plans that can be paired with tax-preferred health savings accounts. Obamacare was enacted into law 15 years ago, and nothing that was promised has come to fruition. It was promised that premiums would be affordable, hence the actual name of the law, the Affordable Care Act, but it's now something that is not worth buying unless the government picks up the cost. That's not what it was intended to do. This has been To My Liberal Friends. Thanks for listening.